The growing concern of colon cancer in young patients. Everything you must know. Hello everyone. I am Dr. Gatas, an assistant professor of hematology oncology. Today, we'll discuss an emerging and concerning topic: the rising incidence of colorectal cancer among individuals under the age of 50 in the United States. This video aims to provide you with vital information and dispel any myths or uncertainties you may have. Over the past few decades, there has been a significant increase in the incidence of colorectal cancer in people younger than 50 in the United States. In 2023, 153,020 people will be diagnosed with colorectal cancer. 19,550 of these will be in people who are younger than 50 years old. 52,550 people will die from the disease, and 3,750 of these deaths will be in those under 50 years old. The number of cases among those younger than 55 has been going up since 1995, increasing from 11% to 20% in 2019. Let's dissect this growing concern with even more granular data. Let's examine the growing concern of colorectal cancer in individuals under 50. Age-related trends show significant increases in new diagnoses across different age brackets. Gender differences reveal rising cases in both men and women under 50. Geographical and ethnic disparities highlight potential lifestyle and demographic factors. Survival rates for this age group have improved, but still lag behind older populations. International comparisons show varying trends in different countries. Overall, there's been a staggering increase in new cases in the US, with about 20% now occurring in individuals under 55. This calls for urgent attention compared to 2 decades ago. Several theories attempt to explain this alarming trend. To decode the reasons behind this alarming trend, it's crucial to discuss theories in detail. Let's explore 4 main categories: diet and lifestyle, environmental factors, genetic factors, and emerging research including gut microbiota. Diet and lifestyle. The Western diet, high in processed foods and low in fiber, has been linked to colorectal cancer. Red and processed meats containing chemicals like heme iron and nitrates are implicated in this disease. Additionally, a sedentary lifestyle associated with obesity is a known risk factor for colorectal cancer. Environmental factors. Certain pesticides like glyphosate and exposure to water pollution, including heavy metals, have been studied for their possible links to colorectal cancer. Living near farmlands and consuming non-organic produce can increase exposure levels. Genetic factors. Approximately 20 to 30% of colorectal cancer patients have a family history, while conditions such as familial adenomatous polyposis, FAP, and Lynch syndrome raise the risk. Hereditary non-polyposis colorectal cancer, HNPCC, also known as Lynch syndrome, accounts for about 3 to 5% of all cases. Emerging research. Recent studies have shown a connection between gut microbiota dysbiosis and inflammation, which can be a precursor to cancer. Certain bacterial strains have been found to be more common in colorectal cancer patients. As we investigate these theories, adopting a multidisciplinary approach that considers diet, genetics, lifestyle, and emerging research is key to understanding and ultimately combating this rising epidemic. Early onset colorectal cancer is a rising concern that demands our attention. Understanding its causes is crucial, but taking action is equally important. Let's dive into preventative measures and screening guidelines to combat this issue. Increase fiber. Opt for whole grains, fruits, and veggies to reduce the risk. Cut processed foods. Say goodbye to high preservative, high sugar, and high sodium foods. Choose fish over red meat. Fatty fish with omega-3 fatty acids can work wonders. Stay active. Aim for 150 minutes of moderate exercise each week. Keep moving. Embrace standing desks, walking meetings, and regular breaks. Moderation is key. Limit alcohol intake and kick that smoking habit. Colonoscopy. Start screening at 45 or earlier if there's a family history. FIT tests. Convenient tests done at home with follow-up colonoscopy if needed. Genetic counseling. Seek it if you have a strong family history or genetic predisposition. Emerging technologies. From liquid biopsies to AI, new tools are being explored. As we conclude, remember that behind every statistic is a life that matters. I urge you to prioritize your health, eat well, stay active, and consult with your healthcare provider about appropriate screenings. Your proactive steps today could be life-saving. Together, we can face the rising challenge of colorectal cancer in younger adults and create a healthier future for all. As a final takeaway, I'd like to empower you with 5 crucial questions to ask your healthcare provider during your next visit. What is my personal risk for developing colorectal cancer given my age, family history, and lifestyle? What are the most suitable screening options for me, and at what age should I start? How can I modify my diet and lifestyle to lower my colorectal cancer risk? Should I consider genetic testing or counseling based on my family's cancer history? What symptoms of colorectal cancer should I be vigilant about, and when should I seek immediate medical advice? Transforming battles into victories, one patient at a time. Tharwat Gattas, MD.